The Northern Regional Hospital is now outfitted with a newly renovated operating theater. For the past 2 years, the hospital has been using an interim facility that limited the hospital's theater services. This operating theater serves the entire north of Belize. It has 2 operating suites, out of which a number of surgeries are being carried out.
Over the past 2 years, our team has been working out of an interim theater, which was not ideal. And in the interim, you only could deal with 1 patient at a time. So with the new renovated theater, we could do at least 2 patients, well, a maximum of 2 patients at the same time. We have 2 operating suites. We have a recovery room. We have pre-op room. We have the area for to sterilize equipment. We have a full functioning operating theater and an area for the staff.
Talk to us about the different surgeries that this operating theater can accommodate.
We do C-sections, we do a host of maternal cases in there and gynecological cases in there. We do general surgeries. We now have on board an orthopedic surgeon, so we can also do that. We do have cases that we don't do here, cardiac and other things like that we don't do here.
But even with only an interim operating facility, Northern Regional Hospital still carried out a large number of surgeries, as well as supported visiting surgical teams to Northern Belize.
You can't shy away from the fact that even though you didn't have ideal working conditions, as I understand it, there were a total of 1,340 surgeries done in your operating room that you had here, that included minor, major surgeries, orthopedic surgeries, gynecological surgeries, planned and emergency surgeries done. I don't have all the data for what you have done in 2017, but for the first 4 months at least, I know there's been a preliminary report of 369 major surgeries done here at Northern Regional Hospital. So that's a huge amount of work that we know happens on a daily basis. My task is basically to acknowledge that you are being given simply something that you need. It's not something that you have been wanting. It's something that is there for you to facilitate the work that you're expected to do with the public.
The renovations to get this operating theater up to standard have been 2 years in the making and valued at almost $500,000. Since this month, surgeries have started in the operating theater, but there are still works left to be completed.
It's a long-awaited and painful wait. I think everyone here can attest to that. I wish it had been celebrated a year ago, but resources is always a challenge, not only for governments, even for households.
As I understand it, the entire ceiling was completely removed. The walls, the flooring, surgical lights are now there that weren't there. Equipment is there. All the entire structure had to be reinforced, as I understand it now, with steel. The ACs that are there is a 7-ton, and they have a backup, 7.5 and 3-ton AC units as a backup to whatever is in there.
It's about $400,000 we spent on this new renovated 2-suite operating theater, which is not the final that we'll do here. But yes, we have to give thanks to the doctors, the nurses, everyone that used only the interim theater for those 2 years.
2 general surgeons and an orthopedic surgeon make up the staff of this operating theater. There are plans to add another surgeon to the team, as well as an anesthesiologist. Reporting for News 5, I'm Andrea Polanco.